Welcome back to Smart Life. I'm Kathy Buccio. And as many of us know, the prices of prescription drugs can vary considerably depending on your insurance plan and sometimes even where you buy them. But some of the most important medicines can be very expensive no matter what insurance you have. Recently, the federal government announced that Medicare would be able to negotiate with drug companies to try to get lower prices on several of the most popular prescriptions. And here to talk more about prescription drug prices, safe medication practices, and why it's so important to follow instructions is Madeline Camejo, Vice President and Chief Pharmacy Officer for Baptist Health South Florida. Welcome to Smart Life, Madeline. It's such a pleasure to have you.
Thank you, Kathy.
Let's get right to it. We hear about the changes. So how will the change allow the government to negotiate the lower prices for certain prescription drugs that affect the prices that most people pay for common medications? As we know, the prescription drug prices are high.
So there's going to be several changes. It's going to probably go over the next 3 years or so, but the several changes to the Medicare plan design will really take place overall. It's going to really help reduce the out-of-pocket expenses for those seniors enrolled in Medicare and really place a cap on out-of-pocket spending for seniors. For example, Medicare Part D will already completely cover vaccines, so they will no longer have to pay copays on these drugs at all. The other thing is that insulin copay will definitely now be capped at no more than $35, which will help really diabetics be able to afford their medications. And then starting in 2024, I think they're going to look at Part D, like the low income subsidy program. They're going to expand their coverage so that more drug costs for these people with limited resources will be able to pay no more than $4.50 for generics. And I think around $11.20 for each of the brand name drugs out there. So it's really going to gear to help the consumer have to pay less out of pocket for them. So being able to negotiate certain drugs as well in the future will then reduce the cost of the drugs for the people who have to pay out of pocket for them.
Absolutely. Do we know, we know there are certain prescription drugs. Do we know which those are? I think there was starting with a list of 10 first, and then there will be more.
Now, there are a list of 10 that's mostly like Eliquis. There are several anticoagulations. It's the first top 10 drugs, I think, that cost them the most. I don't know them off the top of my head, but definitely for sure it's going to be like Eliquis, some of the anticoagulants, some of the diabetic medications as well. And I think there's one or two for Crohn's, like Stelara is also going to be. So there's probably about top 10 that is going to start, but it won't start taking effect, I think, until 2026 because they have to do that negotiation with all these pharmaceuticals. So the first rollout will definitely be phase 1 is to look at lowering the cost for insulin, lowering the cost for the low subsidy program, and then no more copays for vaccines, because they really want to do is push seniors to get vaccinated with the pneumonia, with the shingles, to keep people healthy so that we end up with less death, because people don't understand that sometimes not getting vaccinated puts them, themselves at risk, because especially as you get older, your immune system doesn't work as well as it was when you were in your 20s, 30s, 40s, and 50s. So as you get older, that immune system, it isn't working as it should be. So getting vaccinated is really an important thing for seniors to do.
Absolutely. That prevention is key. It's so important as well, Madeline, for patients to follow the pharmacy instructions as well. Can you talk a little bit about why it's important to speak to your pharmacist and get that information so that you can take your prescriptions properly?
Sure. People don't realize that more than 1/3 of medication-related hospitalizations are really due to patients' failure to adhere to their medication instructions. The right dose at the right time really ensures effective use of their prescribed medications. And, pharmacy label will usually include all the details on dosage, the frequency, timing. If there's any special instructions, such as taking medications with or without food, by following those instructions, people really maximize the benefits of their medications, but also minimize potential risk or side effects.
Absolutely. So what are some tips that people who take medication should use to keep themselves and their family safe?
Well, the number one tip is follow instructions. You should only take the amount directed. Don't cut your pill in half to, if you can't afford your medication, some people sometimes cut their pill in half. Don't do that. Taking more than the recommended dose or too early can lead to unwanted or dangerous side effects. So always follow the instructions that is provided on the label. The second thing I would say is pitch anything that is expired, medications that has passed its can be ineffective or even become toxic later. So if you have old meds, don't take any old meds or save meds to take it later. It's just not worth the risk. The other thing I would say, folks that have grandchildren or children around, store meds safely. Children's and pets tend to be notorious for getting into things they shouldn't, including medications. So don't leave meds easily accessible or next to a nightstand. That can be dangerous for your family. The other thing is don't ignore side effects. I think some people think, oh, I'm going to get a side effect. But if the side effect actually persists and continues to get worse, contact your primary care immediately, or even talk to a pharmacist that you might be able to get onto another medication instead. Don't suffer through stuff that you don't need to. So make sure if you're getting severe side effects, talk to your primary care provider or your pharmacist. And the last but not least is don't share your medications. Medications are prescribed for you. Don't share unused medications with other people in case, and don't store unused meds if you need it later. Again, you don't want to keep meds that have been there 2 or 3 years in a shelf.
Right.
Those medications are not good to take later.
Don't be your own pharmacist, basically. Ask the pharmacist.
I would agree.
And lastly, anything else you think people should know about safe medication practices?
Yeah, I think the one thing I would tell you is if you're on medications and you're considering on taking any kind of vitamins or supplements, make sure you talk to your pharmacist, because sometimes people don't realize, like ginkgo biloba, it's an herbal, does interact with a lot of medications and can cause you to have other types of side effects. So if you want to get healthy or you're trying to try some new vitamins, whatever, always talk to your pharmacist if you're on certain medications to make sure that you're not going to get, or an herbal can also make your medication ineffective. So it's important to, even if you're going to do supplements or herbals, to please, discuss that with a pharmacist before you do that.
Thank you so much, Madeline. And thank you so much for joining us here on The Smart Life.